Welcome to this video on blood pressure regulation. In this lesson, we'll explore the role of baroreceptors, chemoreceptors and the renin-angiotensin-aldosterone system in regulating blood pressure. Blood pressure is the pressure exerted by circulating blood on the walls of blood vessels. The body maintains it within a narrow range to ensure tissues receive enough oxygen and nutrients. Regulation involves rapid neural mechanisms and slower hormonal and renal systems working together to keep blood pressure stable despite internal and external changes. Neural control provides rapid adjustments in blood pressure. Specialized sensors detect changes in pressure or chemical composition of blood and send signals to the cardiovascular control center in the medulla oblongata. The autonomic nervous system then modifies heart rate, cardiac output, and vessel diameter to restore normal blood pressure. Baroreceptors are stretch-sensitive nerve endings located in the carotid sinus and aortic arch. When blood pressure rises, the arterial walls stretch more, leading to increased firing of baroreceptor signals to the brainstem. Conversely, a fall in BP reduces firing, signaling the need for compensatory mechanisms to restore normal pressure. Baroreceptor reflex mechanism. The baroreceptor reflex provides immediate control over blood pressure. When blood pressure rises, baroreceptor signals the medulla to reduce sympathetic output and increase parasympathetic tone, causing heart rate and vessel tone to decrease. In contrast, low blood pressure reduces baroreceptor firing, increases sympathetic activity, which elevates heart rate and constricts vessels to raise blood pressure. Chemoreceptors, which are the chemical sensors. Chemoreceptors are located near baroreceptors in the carotid and aortic bodies. They are sensitive to low oxygen, high carbon dioxide, and decreased blood pH. When these conditions are detected, chemoreceptors stimulate the respiratory center to increase breathing and also activate the cardiovascular center to increase heart rate and vasoconstriction, helping to restore oxygen delivery and normal gas levels. Chemoreceptor reflex. During hypoxia or hypercapnia, chemoreceptors send signals to the medulla which increases sympathetic stimulation. This causes an increase in heart rate and vasoconstriction, thereby raising blood pressure and directing more blood flow toward essential organs like the brain and heart. The renin-angiotensin-aldosterone system plays a critical role in long-term regulation of blood pressure. It is activated when blood pressure or sodium levels drop or when the sympathetic nervous system is stimulated. The kidneys release renin, setting off a cascade that helps restore blood volume and pressure. On the right side, the whole cascade is shown by a flow diagram. In this slide, you can see all the steps of renin-angiotensin-aldosterone system. When renal perfusion decreases, juxtaglomerular cells in the kidney release renin. Renin acts on angiotensinogen, a liver-produced protein, to form angiotensin 1. This is converted by angiotensin converting enzyme in the lungs to angiotensin 2, a potent vasoconstrictor. Angiotensin 2 also stimulates aldosterone and antidiuretic hormone release, both of which help conserve water and sodium, thus increasing blood volume and pressure. Aldosterone acts on the distal tubules and collecting ducts of the kidney to enhance sodium and water reabsorption while promoting potassium excretion. This increases blood volume. Antidiuretic hormone or vasopressin is secreted by the posterior pituitary and helps the kidney retain water while also constricting blood vessels. Both hormones raise blood pressure by increasing blood volume and vascular tone. In summary, baroreceptors and chemoreceptors provide rapid short-term regulation of blood pressure through neural reflexes. The renin-angiotensin-aldosterone system and renal systems contribute to long-term control by adjusting blood volume and vascular resistance. Together, these mechanisms maintain stable blood pressure and ensure proper tissue perfusion. This table summarizes how each mechanism functions at different time scales to maintain homeostasis. Neural mechanisms provide immediate adjustments, while hormonal systems like renin-angiotensin-aldosterone system ensure long-term stability. In conclusion, maintaining normal blood pressure is crucial for adequate tissue perfusion and overall body function. The coordination between rapid neural reflexes and slower hormonal adjustments ensures that the cardiovascular system can adapt effectively to any challenge, preserving internal balance and health. Thank you for watching. Stay curious and keep your blood pressure under control. Subscribe for more anatomy and physiology videos.